Hi, good morning, everyone. As Claire kindly said, I'm Susan Marshall. I'm the Diabetes Network Project Manager at the National Strategic Clinical Network for Diabetes, and that's within the NHS Wales. Next slide, please. Sorry.
That's fine.
Lovely. Okay, so bear with me a second, see what I can see. Sorry, I'm just moving between a couple of screens. So the role and the purpose of the NHS Wales Executive. The NHS Wales Executive was established on the 1st of April 2023, and it plays an important role in making our healthcare system fit for the future by driving improvements in quality and safety, resulting in better and more equitable outcomes, access and patient experience, reduced variation and improvements in population health. The purpose is to provide strong leadership and strategic direction, enabling, supporting and directing the NHS in Wales to transform clinical services in line with national priorities and standards. The role is working on behalf of Welsh Government. The NHS Wales Executive provides strong leadership and strategic direction, enabling, supporting and directing, where necessary, NHS organisations to deliver national priorities and standards and to safeguard and improve the quality and safety of care by strengthening national leadership and support for quality improvement, by providing more central direction to ensure a consistent and equitable approach to national and regional planning based on outcomes, by enabling stronger performance management arrangements, including capacity to challenge and to support organisations that are not operating as expected. Next slide, please. Sorry, Claire. Okay, so the aims of the National Strategic Clinical Networks. The aims are to lead, coordinate and oversee directly the implementation of pathways and other service features as determined by a range of drivers. The network will consist of colleagues with a broad base of knowledge from across primary and secondary care, across the full range of health and care professionals. The perspective of the patient will inform the work undertaken, and the network will engage with a range of third sector organisations to support service design. The strategic remit will be a space for discussing the direction and consider the questions: are we doing things right? And also, are we doing the right things? It is our opportunity to ensure that the right things are put into effect. The clinical networks are a core part of the NHS executive and will give their outputs much greater influence and weight in directing the services. They will be expected to play a much greater role in holding the system to account. Next slide, please. Okay, so within the NHS Wales Executive, the National Strategic Clinical Networks will be a key component of the National Clinical Framework Model. They will perform the central role in the knowledge to practice element in the learning health and care systems laid out in the National Clinical Framework. They will play a leading role in fulfilling the expectations set out in the Executive's mandate and remit letter. And they will have overall accountability through the National Director of Networks and Planning and the Executive Senior Leadership Team through to the Welsh Government Health and Social Services Group and an Executive Directors Team. Next slide, please. Great, so here we have the model. This is the governance, accountability and operating model. This sets the direction for policy and priorities. We have reporting and accountability. So you will see in the middle, we've got the NHS Wales Executive, and then one side we've got the NHS, we've got Welsh Government, and then NHS Wales. So this is all about co-production and collaboration. We've got the mandate and the annual remit letter, the standards, guidance, tools, support and collaboration. And then we have the intelligence, the feedback, the local innovation and transformation. And then the executive annual work plan delivery, NHS Wales reporting, policy development, analysis, intelligence and advice. So by providing a central guiding hand, working in partnership for and on behalf of Welsh Government in and with the NHS in Wales, working together, improving patient outcomes. Next slide, please. So the National Strategic Clinical Network for Diabetes. So this is where we're moving on now to the Diabetes Network and where we are now. So the Diabetes Network went live on the 1st of October 2023. During this time, we've established a leadership group and a clinical reference group. The network are having regular core team meetings that are taking place on a bi-monthly basis. A stakeholder mapping exercise has been undertaken, and this is in order to develop a communication plan. Financial planning has also taken place, and this is to identify the staffing. So the National Strategic Clinical Network for Diabetes priorities. Following meetings with colleagues at Welsh Government, the following has been identified as the key priorities for the network. We have prevention of type 2 diabetes, the education and self-management for people living with diabetes, the 8 essential care processes, and the increase in use of technology for people living with diabetes. Oops. Go back one. Lovely, thank you. So this moves nicely on now to the Diabetes Network, the perspective of the patient. And as I mentioned earlier, the perspective of the patient will inform the work undertaken, and the network will also engage with a range of third sector organisations to support service design. The Diabetes Network will be working with patients to co-produce work. The voice of the patient is really important to us. The voice of the person living with diabetes will help improve diabetes care. Next slide, please. Lovely. So that kind of brings us to a close, really. And just to say that we are looking at new ways of working. We are looking at a new patient forum. And if there is anybody here today who would like to become a patient representative, and sit on the new patient forum, the patient forum that we're pulling together, please contact me via email outside the meeting. And just to say thank you very much. Thank you, Claire.